Hi, my name is Dr. Shalini Kamodia, and I'm a dentist at Gentle Dental Care in Vestal, New York. Today I wanted to talk to you about cavity fillings and what we're doing when you come in and we need to remove a cavity and put a filling in. So really what's happened is there's a hole in your mouth because there was an infection, and over time your tooth became weak and a piece of it broke. So now there's a hole where stuff is getting stuck, and we want to take care of that before it gets bigger and the cavity gets to the nerve of the tooth. When a cavity is really small, it means you're not going to have a lot of sensitivity because it's not very close to the nerve yet. But as it continues to get bigger and over time, if nothing is done, the bacteria in your mouth will reach the nerve of your tooth, and that can cause a toothache. So when we're doing a cavity filling, what we're doing is removing the bacteria and the decay that's inside of that tooth, and then filling that area with a plastic material. It's a tooth-colored white material that will seal that hole so that you can't get food and bacteria in that area again. That prevents the tooth from being sensitive, and it prevents you from getting a cavity in the future in the same spot as long as you are keeping it clean at home. So the process to get a filling is you come in, and depending on how deep the filling is, we get the tooth numb so that you don't feel anything that we're doing. We remove the decay that's in there. Then we separate the tooth from the rest of your mouth. We need to keep it really dry when we're doing a filling, otherwise the material doesn't stick to your tooth correctly. So once the tooth is really dry, we put that filling material in and sculpt it into the shape of a tooth again, so it looks and feels like a natural tooth when we're done. After we're done with the filling, we make sure your bite feels normal and make sure everything is nice and smooth and you're feeling comfortable before you go. After you have a filling done, it's normal to have a little bit of sensitivity for a day or two. If I was punching your arm, it would be sore the next day, and that would heal in a couple of days. The same thing is true for your tooth. Even though you're numb when we're working on the filling, we're pounding on that tooth a little bit to get that decay out. And so it's normal for it to be sore for a day or two afterwards, but nothing crazy. Over-the-counter pain medication is more than enough, and most people feel that they're feeling great as soon as they leave. So if you have any questions about getting fillings and you're unsure about whether you need fillings or not, definitely speak to a dentist and ask for their professional recommendation about what kind of cavities you have and if fillings are the right answer for you.